Hi, Alan. It's Easter Sunday, and we are having our first annual Easter
Yes.
Sunday podcast. And so I want to talk about something that both of us have experienced to some extent, and God knows we could talk about so many things, and we have on an individual basis on how the system can be very punitive unfairly, and actually show us how little power we have and how much we could be squashed like flies, which is kind of what primary care doctors are now. We
Hmm.
are little insects that annoy the specialists and annoy the medical industrial complex, and they just swat us away whenever they want to. And we have no power.
Yeah.
We just do it when. So
So you're right, Andy. So good morning, everyone, and happy Easter and Passover, whatever you celebrate. But you're right. There's a battle going on in healthcare between the medical industrial complex, which we've discussed on this program before, of, big pharma, device makers, hospital systems, the insurance companies. And unfortunately, many of the doctors, or maybe most of the doctors that are making a killing, the specialists, they accelerate the cost of healthcare. They don't improve the quality of healthcare. And when crap goes wrong, we get more work and we get blamed. And we're just tired and angry and tired of taking it from everyone, including our colleagues. So why don't you tell them what happened with your friends, the cardiologist?
it reminds me of that movie Network from a long time ago, where the news reporter finally had enough about the news, and he stood outside, and I'm mad as hell, and I'm not going to take it anymore.
Uh,
And I'm almost there, Alan. I gotta tell you. So this is an egg, because it's Easter. This is you can see it's brown. It's a hard-boiled, pasture-raised, organic egg. Just so you know. Which, by the way, back in the day, when Easter was around during the Roman times and all the way up probably through maybe 1950, every egg was pasture raised organic. Every
yes.
just not, now we have industrialized, pesticide laden eggs. But so I do a newsletter for my practice, and it comes out every other month, and I put in articles like studies that I've found over those 2 months that I think will be interesting to a geriatric population. And some of them are counterfactual. In other words, they break the mold of what a lot of patients are told. So I've had studies recently about how high fat foods are good for you. And this is, by the way, not controversial in the nutrition community, but in the medical community, especially the cardiology community, it's like, the most awful heresy you could say. But even eggs, right, which are, if you get the right eggs, super healthy for you. And I also talk about how a lot of things like cholesterol are different in elderly people. There have been some studies this year that show high cholesterol prolongs life, prevents dementia. Statins can make dementia worse, just things like that. And I have articles that kind of talk about that, but mostly talk about other stuff. Anyway, I come back from a conference, and I receive a letter from the Maryland Board of Medicine that the cardiologist, big cardiology group in my town, these guys are making well over $1 million each. Every year, Alan, they do nuclear stress tests, echocardiograms, and carotid ultrasounds on their patients who are asymptomatic, feeling great, no problem, stable, every year on machines they own, which to me has been fraudulent. And
Yeah, absolutely.
I didn't complain. And my feeling as a doctor is and they say things that are outrageous. Like they tell some older patients who are fall risks that if they don't go on blood thinners, Eliquis, they could get a stroke before they get home. That's how quickly they're going to get a stroke. They will die for sure. That if they don't get their LDL cholesterol below 70, they will die. They're like that. And to me, they're dangerous doctors. But I don't say anything to them. It's my job to convince my patients otherwise. That I have to use articles and studies and experience to do that. But they didn't feel that way because one of them got their hands on my newsletter and made the complaint against the Board of Medicine against me that I was disseminating misinformation, that I was not following the dictates of the American College of Cardiology, which, by the way, is not my college. I never went to that college, and nor do I subscribe to them. They are a trade group for cardiologists who publish studies that are beneficial to cardiologists. They are the largest lobbying group in Congress. They are the reason that cardiologists get paid outrageous amounts of money for things that that the techs could do at the same level for one hundredth the price. And that's what I'm supposed to adhere to. And then they said I'm dangerous and I need to be quieted down. So the board is now investigating me because I wrote a newsletter that included studies that the cardiologists were offended by.
Right. And they're saying they actually are the medical boards could literally take away our freedom of speech based on the opinion of another doctor. And that really is like a communistic society that we're entering. And healthcare really, like, people don't realize it. It really is like, it's like a cult. The healthcare system and the doctors, they're like in these cult groups that, you know, they have these blinders on and they're looking at one thing. I was actually listening to your blog the other day that you did from, I forget that organization. I didn't see the whole thing yet, your part alone. But one of the people on there was talking about how specialists are great, but they look at things in a very, microptic way, your heart and the number, and they're not looking at human beings, which primary care doctors do. And they have their own opinion, and if you don't follow it, you're wrong. And it's not just cardiologists, it's all of them. I have a patient in the hospital right now who came in, she broke her ankle. Okay. She needed surgery. She went to the OR. They put her on anticoagulants post-op, which they always do, and she started vaginal hemorrhage. She's 75 years old. So we did some tests. It looks like she probably has like uterine sarcoma. And what do I do? Her hemoglobin dropped from like 14 to 7. I needed to transfuse her 2 units, and I stopped the anticoagulant, and the orthopedic got enraged. She could have a blood clot. She could have a DVT and die. I said, oh, I'm going to let her bleed to death. But that's the myopic that they have because the reason is if she has a blood clot post-op, it affects their scorecard.
And that's what they care about, right? They care about their little realm, and their number fixing. And I have had similar experiences with this same cardiology group where people are hemorrhaging blood and they have atrial fibrillation. And they say, well, we can maybe stop the blood thinner for a couple hours or a day. Meanwhile, Alan, you and I have looked at all the studies on blood thinners. They clearly do not do what the cardiologists promise they do. In fact, one of the people in this group, when I tried to present studies explaining that, and we wrote an article about anticoagulation in the elderly, the guy hung up the phone on me. He did not want to listen. He just wants you to comply. And the worst part of this is, Alan, is the medical boards are composed of specialists who are all kind of like a little gang. They don't like us. And we don't have time to be on medical boards, nor do we have the resources. We have to work to actually live. They don't actually. But so they go on the boards, they run the show. And yeah, you can get in big trouble if you don't do what they say because that orthopedist has got
Yep.
allies that you don't have.
And they're actually, not just that they don't like us, they would actually hope that we cease to exist. Okay.
Yes.
So we are both clinicians that love NPs and, PAs. I'm a PA myself. I've said that before, in a prior lifetime. My brother's a PA. Our hospital employs them. My personal practice and Andy's employs NPs. So we're not anti, but working in a collaborative relationship. If we're gone, they're going to be very happy because the person that comes into our offices with chest pain, no matter what, is going to a cardiologist because these people are undertrained. They don't have the experience that we have for 40 years. They don't have the underlying knowledge of pathophysiology. They don't know how to read a study. They don't know what's right or wrong. And therefore, chest pain goes to a cardiologist. And that is just what escalates the cost of healthcare and doesn't improve it at all because all chest pain is not from the heart. And they don't know that.
And it is kind of in the algorithm of what they're supposed to do is to send people to specialists. The old adage that we in primary care are just the gatekeepers. We're there so we can figure out which specialists people go to is not how you and I practice, Alan. We believe once you send someone to a specialist, there has to be a reason because maybe it's a second opinion, maybe they do a procedure that we can't do. But generally, we get afraid of it because
No,
we realize once we do that, the whole patient gets lost. Scare tactics might be introduced. You are going to die if you don't do this. And if you get side effects, they do send you to other specialists. it's we they don't want us there. So the fact that a doctor group was so offended by studies that I presented in a newsletter to my patients that they would actually, you don't understand the people listening, you do, Alan, that when things go to the board, often you need a lawyer. I mean, it
No, you
gets
need a
to that
lawyer.
level. I mean, this is no minor thing, and they will investigate it. And I send in articles we wrote that contradict what they say, and it won't matter because the whole board is filled with specialists, many cardiologists as well, and they're going to use this opportunity to try to punitively silence me, which is I didn't do anything. All I was talking. And if they were so clever and really understood what they were doing, they would say, look, Dr. Lazarus is wrong. Let me explain why. There are these studies here. He's using these studies, but this is how I interpret these studies. And then the patient will come back to me and say, this is what Dr. X said. What do you say? Kind of like there is a differing of opinion because that's science.
Well,
Science is
and
not
look,
stat, but they don't like science.
we know that most of these studies, 90%, I think you quote, is just funded by the pharmaceutical companies, or if they're funded by the NIH or others, they're funded through the pharmaceutical companies anyway. So it all comes down to pharmaceutical funding. And we know that, 90% of that data eventually gets proven to be wrong. We could talk about aspirin in our career, over the time we've done it. Take aspirin, don't take aspirin, take aspirin, don't take aspirin. It's flip-flopped at least half a dozen times in my time. And, there's clinical judgment that comes in there, but these people don't have clinical judgment because they're not treating people, they're treating numbers. And it's very, very simple. And
And that's right. They follow protocols. And when the American College of Cardiology changes its cholesterol guidelines to push LDL under 70, they don't ask where that came from, what studies were used. It's funny, your ex-student, who's very smart, by the way, um, he pulled out a 2009 study, which was what these guidelines were kind of what triggered these guidelines. And its study is three or four pharmaceutical companies are in the bottom. You and I know to look for that kind of stuff. But the study is two things. One, it says it shows that people who show up to the hospital with a heart attack have a scattergram of cholesterol. There are just as many with low cholesterol as high cholesterol. There's no correlation between cholesterol and heart attacks. You and I would look at the study and say, wow, that's pretty compelling evidence that, cholesterol doesn't make a difference. The authors of the study, and this was published in the American College of Cardiology Journal, authors of the study says this proves we have to push cholesterol even lower. We're not pushing it low enough because even the low cholesterol had a lot of heart attacks. That now the cardiologist would say, yeah, it makes sense because they just take their marching orders from these groups, and these groups are why they make so much money. So of course they're going to do what they're told. They don't care about the patient.
right.
They care about numbers.
And every guideline, we talked about the lipid guidelines and the blood pressure guidelines and the stroke guidelines. Every guideline that comes out is funded by pharma once again and is pushing more and more drugs and more treatments and doing more and more things to people rather than more and more things for people. And people are not living longer. They're falling more. We have more falls with more bleeds, with more complications and earlier mortality than the rest of the world that doesn't do all this crap.
And one of the articles they took offense of, which was most of these articles I use are from Europe because in this country, forget about it, unfortunately. But one of them showed that it's a factual study. Shows over the last 10 years, the stroke incidence has gone up. Deaths from strokes have gone up. This in the setting of more people taking statins and more people taking blood thinners to prevent strokes. They don't like that. They don't like facts, Alan. If a fact gets in their way with their dogma, then they get angry. And I think that's part of why they went after me and called me dangerous because I'm presenting these facts which really get in the way of their narrative. And it brings up the question, and I've talked to other people about it. That documentary you mentioned was from a health group that Epic Health, Epoch, I don't know what they're called, but they do a lot of articles on overtreatment as well. And a lot of times they'll call me and just what the health reporter will ask me questions. But I told her what happened, and she said, the real problem is, are you guys beholden to protocols? How much are you beholden to
Yes.
these protocols? Are they, because if we are, Alan, then we might as well be AI computers. Just program with the protocols and tell people what their numbers should be. And that's the end of
Well,
the question.
That's how you get these, grades from CMS and these little stars, and the littlest stars mean enhancement bonuses on meaningless metrics. What the blood pressure is. If you think, a 150 is a good blood pressure in an 80-year-old, which most we do, you're being dinged because it's not 130. And again, it's just stupid guidelines that have nothing to do with wellness and health. It's purely numbers, and it's purely about more drugs, more treatments, more tests with no improved outcomes.
And by the way, Alan, it's 120 now. The new blood pressure guidelines are pushing it down. But yes, and the guidelines are the very word guideline means kind of like advice. It's something you should look at. But you and I look at the guidelines and say, well, what pharmaceutical studies are in there? They're generally junk studies. The
Yeah.
cardiologists, the ologists, we'll call them, all of them, don't look at that. They say, okay, now we have new guidelines to follow. And I would imagine a lot of doctors do that. And that's fine. That's if they want to be kind of computer robotic doctors, that's fine. But you and I don't.
And
And
we,
we care
there's
about
just there's
people.
just no common sense. It was like 5 years ago, I think, what was it, the gold guidelines for asthma and another guideline for COPD came up with this ridiculous thing that people should be using inhaled steroids as needed. So we know that when you have asthma and COPD, that steroids are helpful, but you got to give it in a dose. You got to give it for a week or two to decrease the inflammation. And that if someone's not breathing, we use a drug called albuterol, which opens their airways right away and makes them breathe. Well, they did like two studies that said if you use drugs like Dulera and Symbicort, which are, I don't know, 350 each
Yeah, very
inhaler,
expensive.
when albuterol is generic and cheap. So if you use those PRN, what's going to happen? They're going to sell $1 million, $1 billion worth of these drugs. And what do we know? Like I tell people all the time when I explain this to them, you have a rash on your hand. Okay. And it's a steroid responsive rash. And you put some steroid on your hand and you rub it in there. What's going to happen? Nothing. You got to do it for days or a week or it's not going to work. Why would anyone think it's going to work that way? Why? Because it was a study that did this. And then who made the guideline behind it? People all working for pharma. It's a corrupted, bastardized system that's no one's thinking how we've gotten to where we are. And we need to blow it up, but no one believes the poor two schmucks here that we're the right ones.
Well, we blowing it up, and I hardly blew it up by having a newsletter for my patient, but it was enough of like I said, we're little mosquitoes. They got a little mosquito landing on their arm. They said we got to swat this thing. We got friends in the board. We're gonna take care of this guy, and we'll shut him up. It's censorship, and censorship about people who think first of all, the word think, critically thinking, and who care about patients, not their numbers or their organs. They care about the entire patient and who have a lot of experience. There are a lot of things these guidelines say that we just know are wrong because we have collectively 75 years of experience. We understand that these things actually don't make any sense. So again, if we are beholden to guidelines, if this becomes like when the board decides, well, you need to follow the American College of Cardiology guidelines, that's going to be your punishment is we're going to review your records in the next year, and if you haven't followed the American College of Cardiology guidelines, we're going to potentially take your license away. If that's the way medicine is right now, we're already in big trouble, but that is a line that cross. So anyone going to medical school, just so you know, the robot program with the guidelines is going to be more effective because you're going to use your brain a little too much, and they don't like that. They don't like the brain part. They want repetition and compliance, and it seems like those in power are going to get their way on this, and it's really scary to me, Alan, that's the case.
And even the AI robots that you're talking about that they're trying to turn into people, they're now studying the studies with the AI robots, showing that they're wrong a
Yeah,
significant amount of the
exactly. They're
time.
smarter, right? Then they're going to be silenced too. They'll be unplugging those robots and finding new robots that they just do not want anyone because the system itself, if patients truly understood where it came from and what makes it go, would be furious. There'd be a revolt in this country against our $5 trillion healthcare system that is making them sicker. But they still believe the doctor and they still believe especially specialists. And I had a patient come to my office last week on Thursday. And the reason, he's a really smart guy. And the reason he came, he made an acute appointment because Friday, which was Good Friday, he was going to the cardiologist. And it was a member of this group that's coming after me. And he said, they put me on this new medicine. My LDL is 80. But the doctor said that's not good enough. I need new drugs. He said, I don't do well with drugs. I don't want to get it any lower. I'm fine. And he said, I'm scared of going there. The reason I'm talking to you is so we can come up with some strategies of what I could say when I get in there so he doesn't get mad at me. I mean, this is where it's come down to. These guys are scaring
Well,
patients.
the first thing in the strategy is don't tell him that Dr. Lazarus is my primary care provider.
Oh, believe me, I told him that, and he said, "Well, he already knows." I said, "Then you're in big freaking trouble." I, I did give him some ideas of how to be passive aggressive with these guys. I said, "You can't say no to them." I said, "You have to have some reason." I said, "But what? Why is this? Why is the doctor visit now this? That he has to be scared of a doctor who's going to bombastically tell him he must get a certain numerical result, or
He's
80
going to die.
or if it's 71, he's going to die. My God, it's got to be below 70. And by the way, this study I mentioned, this 2009 study, you know how many people were below 70 in this study? 2%. So that means these guys want to medicate 98% of Americans to get their, this is the new cholesterol guidelines, to get their LDL below 70. And if it's 71, they're going to have to go on the newest med, $50,000 a year, that the drug rep is in their office every day. So yeah, they're scared. One of the things I talked about in this documentary I was in was that when patients go to the exam room, it's their visit. It's not the doctor's visit. But the doctor doesn't let you think that way. That especially these specialists tell you what you must do or you're going to die. It's usually that's the discussion. There's no nuance, subtlety. There's no science. They got a computer that calculates your risk of dying before you leave unless you do what they say. And these computers, of course, are
So,
programmed by drug company studies, just like we always talk about.
yeah, so you know what, Andy, the moral is the story is, and we could get picked up by our medical boards as well, is that everybody should have a primary care doc, one that you trust, one that you're going to listen to, one that's going to share the data and give you the pros and cons of what the specialist is going to do. It's not about, and that was really interesting in that documentary as well. It wasn't about listening to what the doctor says. It's about a patient-centered shared decision-making relationship where you talk back and forth and you come to a conclusion of what's best for that individual, not what's best for the 350 million people in this country. What is best for the person in front of you? And it's usually less, not more.
And the people in that documentary, I was the schmuck in the group, but they're big academics. One of the guys was the head of Kaiser, the former CEO of Kaiser, and we all had the same message, which is what you said, which is that unless we have a primary care system, we're in big trouble because the specialists ultimately are going to twist the system to make money, and that's what they're interested in. And they all said it. Everyone in this
Yep,
documentary
they
said
did.
it. And it's like we know that we're going the wrong way with specialization, and we also know the power they have over us primary care. So you and I, yes, everyone needs a primary care physician, but we're becoming an extinct breed. And after like getting attacked for just putting art studies in a newsletter and being and the board going after me, the board of medicine, who's going into this field? It's just that's the sadness is they're going to win in the end unless we really push back. And you and I push back. That's why we get in trouble all the time.
Yeah, our own kids are becoming doctors, and they don't want to do what we're doing because they see we get browbeated every freaking day, and we're coming home late at night, and we're leaving earlier in the morning. Like he's a student, and I'm still gone before him and come home after him, and it's like it's just too much. It's
But
not
we're going to
fair.
keep fighting, right,
We're gonna
Alan?
we're gonna keep fighting.
Board be damned, regulators be damned. We're gonna do
All
what we have
right,
to make sense of the system.
all
So,
right.
by the way, our book Return to Healing really gives the data to support everything we say. This is not a dataless argument. This is where the evidence is,
Yeah,
and it's well
I agree.
known.
You know. I'm having like 5 or 6 patients every week bring in the book for me to sign, and they're all saying the same thing. Like, I didn't realize this was such a messed up system and how easy it is to fix if people just listen to us.
Oh, so easy to fix. And unfortunately, the cardiologist would send this to the board, but that'd be okay because at some point we'll be able to be on the board. I hope that'll be wonderful.
We're not rich enough for that.
We're not. We can't do it. We'd have to retire first, but that's at this rate, that's going to be forever. Um, anyway, Alan, have a good
You
rest of the
too.
Sunday, and we will always talk soon.
Take care, everybody.